Barry Kirika, the founder and executive director of Enable. I'm very excited to be here. This is the assistive technology topic. It's a very, very important topic to us. And I hope you all had a chance to listen in on the Mastercard Foundation 18 report that they just completed and launched this morning. I think there's a lot to that report. Most importantly, at Enable, we believe that when it comes to 18, we have to have a mix for this to be sustainable. Meaning that we can do some importations from across the world, but also we have to work on local manufacturing. And the most exciting thing is that we have so many innovators, and we normally do a call for innovations every year. And most of the time we receive between 60 to 80 innovations from across the continent. And it's amazing to see in the last 4 years the progress that we are making in terms of innovators really coming out with amazing products. So we do believe we have a lot of work to do to support the innovators so that they can develop more products, so that they can get the right type of expertise, the right type of funding to take the products to market. And this is because we often that by importing everything, we cannot be able to provide enough access to all these products. And most importantly, if we develop products locally, most probably they'll be affordable and they'll be accessible in terms of when you think about preparing products. I've had stories where someone bought a wheelchair that came from out of the country. Within a year, the wheelchair was damaged. Most probably because of the terrain of where we are in Africa. That product was not designed for the African terrain. But there are certain products that we have to import, and then others we have to do to innovate. That's the whole idea. Now, I won't say much after this. We have an amazing, amazing team of speakers. But before I go into that, the one thing I want to invite you to do is please scan this QR code if you're interested in joining the Inclusive Africa 18 network. What we want to do and what we are already doing, we've already come together. We want to bring Africans together, the global community, to actually begin to understand what's going on in the continent, because the space is very fragmented. There's a lot of people who are doing amazing stuff, but we want to know who's doing what, when, and how. But how can we share knowledge? How can we do research together? How can we at least know, can I buy products from Zambia instead of importing from China, because maybe they are locally available? So let's connect, let's share knowledge. So if you can take that, if you can scan the QR code, then we can keep you informed as we have multiple meetings a year. Last but not least, I want to say thank you to David and Bernard for being very instrumental. They're actually the chair and the vice chair of the 18 Inclusive Africa Network. So I want to say thank you so much to them because they've done a lot of work before today. But also in terms of preparing the team, we have an amazing team of speakers. So please enjoy, and who do I hand over to? Fantastic, thank you.
Thank you. Where are my microphones? Got one here, one here. Okay, can we just take this one here to Bernard? Otherwise nobody will hear it. Okay, one on each side, one on the right. Good morning. I thought it was wonderful, it's Friday, but it's going to be a great day. And then there's not an error in my thinking from the very beginning. Because it's somebody how confused today it's going to be as we work through our agenda.
But I do also want to plug, because we're talking about innovation, if you are innovating, do remember the Zero Project conference and awards next year. The innovations, call for innovations is open. Now is the time to nominate yourself and put yourself forward. You agree, Wilfred? If you want to know more about it, Wilfred is there to speak to, and Anya is also around somewhere in the building. Okay, so, I've got Fred on my chair. We wanted to start really today with a very grounded discussion. We wanted to come back to really practical lived experience of assistive technology in Africa. So we're going to start with our first three colleagues, which is Joel, Mark, and Jenny. Really to talk about lived experience of AT in Africa. Now, we originally framed this as the experience of youth, and then I came to Jenny this morning and I said, Okay, so you said, well, I was young once. So we're going to start with you, actually, Jenny, because of that. Because you're giving us a slightly more historic perspective on this. Yeah. If you just pass that one there, yeah.
Here we go.
So, Jenny,
Hi.
tell me, what AT did you use when you were young,
When
and what
I-
are you using now?
Yeah. So, I started a while ago, so I'm youthless, okay, but I'm not useless. So, just to say, in the beginning, I used a handheld magnifier. For low vision, the problem, I think, is not just availability of the technology. Came from a privileged background, so I got a round-top magnifier. I think Louis just showed some of those initial handheld magnifiers before. But what I landed up using, because I didn't want to look weird, and I think this is a conversation to have around adoptability. Just because the AT is available doesn't mean your user is going to adopt it, because using it affects your identity. And so as a child, there were 4 visually impaired kids in the family. 2 adopted, I didn't. And so, yeah, I rather used binoculars to look, a little, well, it was more normal than a magnifier. And I used them, the sports field. But a lot of stuff was given to me, if I can say it, but not much of it was useful. And I didn't want to feel weird as a young person in the classroom. I wanted to just be the same as everyone else.
I loved feeling weird. Mark, if you just pass the microphone along to Mark. Tell me, what assistive technologies have you used?
Okay, so first let me tell you something about myself. I was actually not born blind. I was fully sighted. And then I lost my vision. I became blind in 10th grade. So I've been using assistive tech for the past 4 or 5 years. And over these 5 years, technology has went a long way. Like at first, it was using mainly AI. I was using screen readers, for example, to help me navigate on my phone and laptop, and using AI, for example, to find objects. But what changed in these 5 years is that AI has really improved, and I have used AI to my advantage and developed my own app called Scribe Me. And basically what it does, it helps you study more independently. Like you could upload any document and Scribe Me will be able to scan the text and describe all images inside this document, making it 100% accessible. So if you have a graph, like a physics graph, it's gonna tell you you have an x-axis, a y-axis. You have the line going up, which indicates a positive change. This is one thing that the app does. And the second is Live Assist, which is a real-time AI assistant that can see through your phone's camera.
Thank you very much. I was also not born with mobility impairment. I think along the way, I had an accident in 2015, and I decided that is when I started using manual wheelchairs. So my mother was the one taking care of me, and every time she would lift me up from wheelchair to bed, and the burden was too much for her. So she also ended up with a wrist condition, and she has been battling with it till now. So when I had the opportunity to go to KUST, I saw students using this electric wheelchair, which was very amazing to me. But most of the times, when they get to rocky areas, people have to come around, push them, which was very sad. So, but when I went to KUST, I was reading disability and rehabilitation studies. So I decided to get approached to them, and that is when my research begins. I got to realize that our background, our systems, and the road is not very conducive for the wheelchairs that comes. And all the wheelchairs are being imported. In Ghana, all the wheelchairs, we import them. So when it comes to Ghana, because of the potholes, they find it difficult. And even when it gets damaged, to get people who can fix it becomes a problem, even spare parts. So we put it upon ourselves. That is when I started this company, Auto East Wheelchair. We manufacture all-terrain ready wheelchairs. It has solar chip into it for off-grid use, and also it has we have networks for repair. So anytime it gets damaged, they can just assist you in repairs.
Who buys it? Who actually is the pays for it? I'm really interested in that.
Yes. So what we do is we partner with organizations so that when someone needs to buy and the person has difficulty in the financial aspect, the organization comes in to support.
Great. Mark, your product, who pays for that?
So we're mainly working B2C. So most of the time, like an individual pays for the monthly subscription, but we're looking to expand to Africa, and by expanding, we're looking to have a sponsor so we could be able to expand in the African market and make it more affordable.
Okay. And Jenny, I know you've got your own product, but also your own experience of how the technology was paid for.
Yeah. It was my parents and then a great aunt who happened to have some cash lying around.
Okay. Bernard, you've heard what people are saying about the range of AT that people are using, the different ways in which it gets paid for. I know that you deal with all sorts of companies and with users. How much of this resonates, do you think, across Africa from what you've heard?
Yeah, so first of all, I think there's an interesting dynamic here from the lived experiences of the three, because they are quite different. But there are some commonalities for the two that acquire the disability.
Yeah.
So for me, it's interesting to hear that it's a dynamic landscape. There's no one way of paying for AT. But I've also heard there are some assumptions, especially around a whole continent like Africa. And the immediate thing that people think is, and nobody can afford to pay for this, so we need a subsidized model. And I think for me that's interesting because it is a dynamic that exists, but sometimes it overshadows other opportunities and other smaller market segments within the disability, I would say market. And I would encourage all entrepreneurs, before you make any assumptions about affordability, really to make sure you understand who your target customer is, because even within the disability landscape, people with disabilities can't be a target market generally. Yeah,
I
very
think
interesting.
it's a really good point, and I'm sure we're going to pick up a lot more on this with our other panelists. But I agree with you. There is this idea that it's too expensive for users to buy. That is true in almost every part of the world. It's not just an African issue.
Yeah.
The vast majority, particularly more complex assistive technology, is not paid for by the individual. It's paid for by government or institutions, charities, not-for-profits, and so on. So I think in one level, Africa's in the same situation as everywhere else. What may not be there is the safety net of who else pays for it if the end user doesn't. That safety net is what is part of what we're going to be talking about.
I agree.
Okay, thank you, our young people. So let's go on to our first panel from here. And our next panel is going to focus on current AT availability and unmet demand. And we're going to be talking here with Satish from ATscale, Sarah from Google, and Fernando from UNICEF. So perhaps we can start, and maybe I can start with you, Fernando. In your experience, when we talk about Africa, what assistive technologies do you see that seem to be best provided across a range of African countries? It's very difficult to talk just about Africa. But what's been your experience? What is the best provision that we've seen?
Well, that's not a straightforward question, right? Because there's so much diversity in Africa. And then there's the more formal approach that you've seen when there's a government ministry and agencies well coordinated. And then there are more challenging situations where in some countries there's a lot of reliance on donations. And the problem with donations, of course, is that it's not always appropriate. It's usually not appropriate to the local market. At UNICEF, we unfortunately have seen situations where a child is given an adult's wheelchair, for example. So it's not only not good for the child, it can actually make whatever health conditions the child
I want to take you back.
Yes.
What is good? Let's focus on our good practice that we can
Yes.
build upon.
Yes.
Because one of the things we always do, we talk about the problems, but when I've been out in the conference, I've heard good things. What are they? What are the things that we should be proud of and be building on?
Well, we've had a number of interesting initiatives.
Yeah.
My mic is a little unstable today. So for example, here in Kenya, there's an initiative called NICO. No one kept out. In this NICO initiative, they have boot camps. So they basically get-togethers that happen where you bring children that have an impairment. You're not sure exactly the type of impairment and so forth. And in this one location, the family can check and see with medical experts, with physicians, check what is the condition, what is the potential situation. And in the same location, they can register with the Kenyan government so that they can receive the benefits. And in the same location, they can talk to pedagogical, to experts, to teachers, to education experts, so that they can be referred. So they have the referral for the medical side, the educational side, and the government registration and identification side. And depending on the type of impairment, they receive an assistive technology to address their need.
Thank you. Satish, can I ask you to pick it up from there? From AT Scale's point of view, what have you seen across Africa that you think there is something here that is valuable and perhaps we should be building on in other parts of the continent?
Yeah, two things which actually comes on top of my mind, and they are very much related with some of the challenges which were brought in earlier on. Who pays for it?
Yeah.
And we have seen some example in country, for example, in Rwanda or in Zambia, where the government has been able to add assistive technology as part of the community health insurance mechanism. Now that's a great way to finance those assistive products. We have still some challenges in those lists, what has been added in, for example, glasses, etc. has not been added, but that's a good start what they could add in the health insurance mechanisms. We had example from Zimbabwe also mentioned today morning, where VAT, value-added taxes, importation taxes, they were completely exempted from assistive technology. Okay. And those are great examples of how things can be scaled up at the country level. But it's not common, and it's not happening everywhere. And I know, David, you mentioned, let's not talk about challenges.
I'm coming on to the challenges, don't worry.
But it is the political willingness from these governments, whether it was Rwanda or Zambia or Zimbabwe, which could make those solutions possible for majority of the people who need assistive technology in those three countries.
Brilliant, thank you. Sarah, you work for this small startup called Google, I understand.
Has anyone heard of it before? We can share our business cards,
Yes.
you might even know our email address.
I think it's really, if I was looking at availability of assistive features and functions, I would say that across Africa, the one thing that you've got in common is the access to mobile phones, potentially, which have assistive features and functions built in. You've got a distribution there based on a mobile phone. How important do you think access to the phone is in terms of successful adoption of the assistive technology features and functions that you've built into it?
Right, well, that's a great question. Actually, Satish and their initiatives with AT Scale would be particularly appropriate in answering. So, of course, it's absolutely critical, and the fact that it's already pervasive, so it's pervasive, assistive technologies on it are free, and so it's a great kind of built-in that is to say, it doesn't solve all problems. So, of course, in some senses, we're talking about the phones, and that's going to be great for navigation in the world. But if you're focusing on things like education in the schools, that may or may not be the best solution. So there's still more to be done, even if we already have this great entrenched infrastructure of people with phones that have the built-in assistive technologies that already do so much and that make it less necessary in many cases to bring on additional assistive technology, which might be expensive, which might be unavailable. So I'm sure to some extent it's perceived as a golden age of assistive technology.
And in terms of access to a mobile device as the basis of AT, in your experience, what do we need to do to ensure that more people with disabilities get access to a platform, to the device, so they get all the benefits of what you're built in?
Right. Well, actually, though, as you were saying, it is, mobile devices seem to be prevalent even in lower resourced areas. So I don't think that there's a shortage of availability of the devices. And if we're talking about Android phones, therefore, there's all of that assistive technology there. I think one of the things, I think two things we're discovering. One is, and this always surprises me, is awareness of the assistive technologies that are available. So even we've taken advantage of this conference to do some training, and it's always surprising that people have the phones in their pocket with the assistive technology free of charge and are not aware that it exists. So I think one of the things that we need to think about is just how to, with a mouthpiece like Google, for God's sakes, and people still don't know about it, how do we make sure that they're taking advantage of what's already there?
I'm going to give a plug here for anybody who's here who hasn't seen it, for a thing called the GARI database for mobile phones, GARI, the Global Accessibility Reporting Initiative. And it's an initiative of the mobile manufacturers. And if you go onto their website at gari.info, it lists hundreds of models and mobile phone and tells you what accessibility features are built into them. So if you're blind and you want a mobile phone, you want to know if it has a screen reader built in, it will tell you. So if you're going out to buy one, you can go to the shop and talk to them and say, this is the models I want to look at. I think the fact that too often people in Africa don't even know that that database exists is a problem. To come back to your
and indeed, is that how they consume information?
Yeah.
I mean, I joke about the fact that, for example, we will announce all of these features and functions and services available through, I don't know, a blog post that goes out by our CEO, which is wonderful, but I don't think that that's how African youth are consuming their information.
I would like Safaricom to have that database in every shop they have. So anybody who's disabled goes into the shop and can say, my cousin, my brother is blind, I need a phone for him. And he said, well, let me look it up for you and tell you what we've got.
Right, right.
Satish, let's come back to you. I'm going to let you go last, Fernando, on this one. What would you add to that in terms of, we're starting to now move into the barriers and the challenges? What would you add to what we've just been saying?
Well, there can be a huge list. But I think two things which I will like to bring in terms of barriers. And that could be specific to digital assistive technology, but that is common to all the different type of assistive technology. I think one of the biggest barriers which we see is lack of political willingness at the country levels. Lack of that willingness, especially at a political level, to translate assistive technology policies into actions. And we have some decent and good policies which are there on paper.
Satish, why is that true? I'm no doubt you're right, but why is that happening? What's your feeling about why do we have that issue?
We still have that issue because policymakers are not aware about different solutions which exist. There are many different solutions which we are talking about since last 3 days here. And when we go to the policymakers and talk about policy change and policy reform and policy dialogue, the only thing they know about is the whole traditional hospital wheelchairs or best an artificial limb or a hearing aid. They don't know about, they're not aware about digital solutions. They are not aware about the various innovative solutions which has come in this space. That also has a reflection on what are the different sort of governance and regulatory mechanisms which exist in the country. Why are we seeing so much of donations happening in the countries? and donation, parachuting in assistive products, which may not be of use for the individual. Jane very eloquently mentioned the difference between availability and use of those products. And that's because they might not be meeting the need of that end user. They might not be appropriate. They're not of quality, which means that there's a huge gap in terms of regulation. In many other countries, we just can't walk in a country and say, this is the product we want to provide.
So whose job is it to make policymakers aware?
It's all of us.
Okay.
All of us sitting here.
So how many people here would describe themselves as policymakers?
None.
One. No, I saw a hand. Okay, good. How many people have had the opportunity or have taken the opportunity to seek to influence policymakers? Good. We're going to come back to you later and find out how that went. What difference did it make? And perhaps at that point we can pass on to Fernando. Fernando, challenges. We'll come back to the policy issue. What else would you add to that?
Well, I think that if data, evidence, if the facts were sufficient, we would all be doing exercise every day, eating vegetables and working less, right? The fact that we are not all doing that means that I think there's more that is needed. So the facts are a requirement that they are not sufficient. I think what we also need is the commitment, is action. And to take action, I think we need to have an emotional understanding, an emotional commitment to changing the system. And so I think policymakers need to be exposed to children that have had access to assistive technology and witness the change that it has made in their lives. They need to see families that suddenly can pursue their activities independently because their child can do things on their own. So I think that makes a huge difference. And also, just one last comment, I think we need to go beyond products and look at ecosystems, which is with AT Scale, UNICEF, we are all focusing on, because the product is there, and like I said before, it is required, but it's not sufficient. The awareness needs to be there, the training needs to be there, the fitting, right? Not every product is appropriate for every person. The maintenance, the repair, all these things need to be there. They are not straightforward because assistive technology is so diverse, from wheelchairs to hearing aids to digital computers. It's incredibly diverse, and each one has its own characteristics. So we need to think of it as an ecosystem. And then we'll have not just effectiveness, we'll have sustainability over time and scalability so everyone in the country can have access to what they need.
I couldn't agree more. I think what you're describing as the ecosystem is what I would describe at the beginning as the need for a fertile landscape, a territory in which the AT seeds, which our entrepreneurs are developing, can begin to grow. But what I want to do just at this point is turn to the audience. And let's try and pick up a couple of these. Oh, Sarah's going to jump in first. Go on. One more from there, then I'm going to steal your
Just
microphone
one more.
from everybody else.
And so we talk about policy. We also always talk about the business opportunities associated with investment here. And somewhere in this, there is a gap. So if policymakers are doing it because they know they have to, there's going to be the level of motivation is going to be where the level of motivation is. If everybody sees it as a business opportunity, we wouldn't even need to be here, as in the business itself would be, the market itself. So this is something I've been ruminating a lot about. What's the gap? I mean, all of us talk about 1.3 billion people. We talk about, the numbers when they have so many, $7 trillion of opportunity if you include the person with disabilities and the extended relationships. There's something wrong in that we're not seeing that realized, and I think it's just not seen as credible. And what I've been thinking is there's a problem with cause and effect. We're good if we say, I will build this, I will sell it, it will make money. The problem here is there's a long chain of activity until you actually see that economic value, which I think makes it much more something that you need entities like governments and foundations to invest in, because a business is going to think, I'll invest in it today and I want my returns within the next quarter. And what happens, what we're saying is, invest in this child today. That child will be self-actualized. They will know how to use this technology. They will go on to higher education. They will get amazing jobs. They will be happy. Their families will be happy. They will be employed. They will not be a burden on the government. They will be an asset to the government because they then pay taxes. And businesses will benefit because they are now consumers. But somebody needs to be thinking with a 20-year worldview when I say that.
Absolutely. I'm going to come back to that in more detail, I think, as we go on. But let's turn. Have we got an usher who likes running around with microphones? Yeah, do you mind, Andre? Thank you very much. Okay, so I want to open this up now to you to expand on what you've heard. And maybe we can just start, go back to the very beginning. In your own countries, in your own experience, what has been working well? What are you proud of and have achieved within those countries? So when you give us your name and the country you're from, so we can reflect back on it later.
Hi, I'm Jackson from South Africa, and we introduce coding concepts to learners without computers, so we can do it in rural communities. And one of the things that have really worked well is that it takes us 3 hours to train teachers in how to implement a program that could last for an entire year in a school. And because teachers can do it by themselves after training for 3 hours, they've been able to adopt it. And probably 80% of our reach is not our team directly, but it's the teachers who are now empowered and equipped with the simple tools to introduce coding, even in contexts that don't have resources. That's worked really well.
Thank you. We've got somebody else at the front here. Peter?
My name is Peter. I'm coming from Ghana. I work with West Africa. We're working with 36 companies in the education space, producing edtech products. And a great collaboration that we have had with the government is that they are allowing us to send these devices to special needs schools.
Excellent.
For them to actually have a feel of it and give feedback for it to be improved. And we work with the school for 3 years for each of the cohorts that are actually in the program. And I see that this responsive wasn't actually there in the first place. And now that they are actually collaborating with us, I think it's a good thing. And plus, there's already a policy for inclusive education. And that's what we are leveraging on in Ghana. Yeah.
Excellent. Anybody else got an example of good practice they want to share? Yeah. You were the one person who put up their hand as policymaker. You are a brave person. I like that.
Hi, everyone. My name is Maureen Sharon. I'm from Neurokids Warriors. I'm from Kenya. Okay, our best achievement is from Bethany Kids Kijabe. They have taught us parents on how to make standing aids and sitting aids for children with a very affordable material like cartons. So we have really achieved from that, and they're still teaching us on parental and also mental health. Thank you.
Excellent. Thank you. Anybody else got one they want to give us? Yeah, please, Satish. I like to. Yeah.
Just to put on the table one more example, which really is quite a good one, on public-private public-private partnership. And we have colleagues, for example, Shona Equip in South Africa, who are producing locally manufactured wheelchairs and mobility devices and seating devices. 60% of those products which are purchased there are purchased by the government through local tenders. And that is a great example of public-private partnership. These should be further scaled up. But that does require that appetite to work with complicated bureaucratic procedures of the government and get those financing made available. Thank you.
I think that complexity that you talk about is an interesting point. But let's now turn that around with the audience. You've given us some examples of good practice. this is the one where probably everybody will put their hand up. What have been the barriers and challenges in your own countries that you've faced in trying to get more assistive technology available to people with disabilities? It seems only fair to let you go first on this one.
Okay. Giving the wrong assistive devices. Giving the wrong assistive devices.
The wrong assistive devices.
Yeah, in terms of giving a wheelchair and somebody is not the same size of that person. Yeah.
Yeah. Okay, other examples of problems and challenges that people have faced? We've got back here.
My name is Blessing Mulumbo from Zambia. Our challenge is access to the devices, especially people in rural areas. Yeah.
Yeah. Okay. I think we had another hand here. Oh, yeah. Okay, over here.
All right, thank you very much. I think one of the challenges that we're faced is a delay in the provision of an assistive device. So it could be an issue of production of the device, or it could be an issue of shipping the device to the country. So that's one of the challenges that we've been facing. Thank you.
I heard a lot a few years ago. I came to Kenya and I was talking to people about their experience of getting wheelchairs. And they were talking to me about how it could take 3 years from going the first application to actually getting the wheelchair. And that's not acceptable. So? Easier now. But they said it wasn't the policy that was the issue. It was the implementation of the policy which was the problem. Is what people were actually doing in the offices. It's not. And this is an interesting problem when we talk about policy, is how we turn policy into practice. Because the aspiration was there to do much more than that. Yeah, another one here. Thank you.
Thank you. My name is Eluaja Jacob from Tanzania. Our challenge in our country is the delay of providing those devices. So the government have started to provide, but the time when they want to provide, we don't have any knowledge how to use those assistive devices in Tanzania. And also, we don't have any center which we can learn how to use our devices, technologies.
That's
Thank
excellent.
you.
Thank you. I'm going to give a quick plug to Rwanda Assistive Technology Association. I don't know if Renee's here. I think he may have gone. Rwanda Assistive Technology Association doing exactly what you're talking about, training people to use the assistive technology that is going to be made available to them, amongst many other things. That's a critical part of the ecosystem that Fernando talked about. Without that, the amount of abandonment of AT will be very high. If people aren't using the AT when it is provided, governments are going to say, well, why should we provide it? It's a vicious circle that we get into, which is why, as Fernando, Satish, and Sir have all said, the ecosystem is critical. What do you think are the most immediate actions that should be taken? Over to you. Yeah, Peter again. Thank you, Asha.
I would always want to start from the pre-teacher education because I work in the education space. The teacher does not know how to use it to even assist the learner. So if we don't start from there, I don't think we will get anywhere. So that's what my one thing I would want to start from.
Somebody said to me about one area of assistive technology, said one of the problems is digital literacy amongst teachers in many parts of Africa is not that high. So hence, expecting them to understand the assistive technologies that it's based on is going to be a real struggle. And I think that's one of the parameters we might need to think about, is actually building up the baseline before we try to build the assistive technology support. Okay? Great example. Other examples of changes that we think should be made? Please.
Yes, just to add to that, I think it should happen before school. Because as we have come across in the communities, very often parents don't see the need for education for their child. So if it can already start from the health centers or medical institutions, so that we don't lose all the time before they go to school.
We talked a lot about schools. In many parts of the world, assistive technology is recommended by people like occupational therapists working with adults. I know that WHO have talked a lot about workforce. How readily available, and what do we do about availability of occupational therapists and other professionals to make the recommendations to make sure that people get the right wheelchair or so on? I'm sorry, I'll let you go in there, jump in there as well.
Hello, I'm Murad. I'm father of Mark on the panel. Yeah. Mark was rejected in 5 universities when he was applying for engineering because people in the university don't know that assistive technology can help him study well in engineering. We took a long time trying to get him to join a university. Finally, we managed, but it takes a long time and a long effort. We came back to 2 universities of this, and when they know how Mark used technology and how he can use assistive technology, they began accepting other students later. I think this is something we need to focus on. Because people don't know how to, it can help to that level.
Okay. We're coming to the end of this first panel, which means I now turn to Bernard to do the hard bit. What do you take away from this discussion, Bernard? How would you summarize this? And does it match with your experience that you've had over the last few years?
Well, it's hard to take all that in and just give a summary. I'm not AI, FYI. But I think there's some really powerful ideas that floated up for me. And one of them, even though it wasn't described as such, is this idea of agency, the agency of the user in this whole conversation. And why I say that is that the traditional model of giving people access to assistive technology is still heavily influenced by this idea of the medical world of kind of like, we are giving this to you, this is what you need. Hence the term provision. And it's not a bad thing, but I feel like the more we can empower people with disabilities to demand for the AT that they need, to be able to be in a position of power when interacting even with the provision systems, then you can actually change the dynamics. The other idea, which I think Satish kind of was talking about the political will, the way I also see that, because the question then was, why isn't there? And I feel like it is because sometimes when you look at politics and why politicians make decisions the way they do, it's because they understand incentives. And also it's because they are responsible for allocating money to different priorities of a country. And most of the times when we talk to that system, we are not connecting the dots with ministries that are really powerful in this space. We know how to talk to the Ministry of Health, we know how to talk to the Ministry of Education, but I think we need to find ways of being able to talk to ministries of finance, treasury, transport, infrastructure, because this idea of ecosystem requires such that it's not just a product, it's also accessibility. For example, if I have a great wheelchair, finally, woo, I have it. But then there is no sidewalks that this wheelchair can get me. Like I can't use it outdoor. Then we still haven't kind of connected the dots. And I feel like if we could find a language and connect those dots and present this as not just a human rights idea, but the smart economic strategy that every country that's trying to develop can adopt, and then have those meetings with these guys, that will be able to have an impact.
Excellent. Thank you, Bernard. I think to help that, the development of things like briefing documents, resources that people here can use to go in with policymakers to make the arguments clearly, coherently, and consistently would also be extremely helpful. Not huge, long reports, but short, sharp briefing documents on impact, the ecosystem, and policy. Thank you to our first panel for kickstarting us. Thank you, everybody, for their contributions. I'm going to go on to our second panel now, who will be nervously thinking, what's he going to do to me? And we're really going to explore now this issue of local production versus importing of assistive technologies and this tension between these two approaches. And again, what we're going to try and do is identify examples of local production that have worked well, in your view, but also where you feel still that actually the best model is to import for whatever reason. So Shona, maybe I can start with you. And I know this is something you feel strongly about. So just tell me a little bit about where have you seen good examples of local production, local fabrication of AT?
Because those markets are being shaped from the ground up, but also supported by policy, which provides the end users the route to take government to court if they don't deliver on what's in the policy. That has enabled companies to actually start becoming sustainable and building markets that didn't previously exist. And they do that in partnership, like we do, with government, who is, as Sadish says, is 68% of our turnover, but also with medical insurance companies and also with, obviously, corporate support, where they're working on the ground. So the products there are focused on right across the board, from intellectual disability, alternate communication systems, mobility equipment, orthotics, prosthetics. So we're really finding that the focus where growth is happening are the products that have been able to be influenced in their design to be appropriate for Africa and for the context.
And these are locally made, locally manufactured products?
Yes,
Great.
Absolutely. And for an example here is solar-powered batteries for hearing aids.
Right.
Most people cannot afford to buy a battery every week. It's not even on the agenda. So they might be given by a charity or by government hearing aid. But if they can't afford the battery, put it in a drawer, you never see it again.
Yep. I think, even things like solar-powered chargers for mobile phones can be very easy developed. Ben, pick up from there in terms of, I know that GDI Hub looks at this quite widely across the world, not just in Africa. But within Africa, what examples of really interesting local manufacture, development, and fabrication has GDI Hub seen?
Yeah, thank you, David. I was just reading the report that was launched earlier, and there's a statistic in there around the amount of local production in Africa being 85%. I think the assumption is that that's not high enough. 15% of production being local to Africa.
85. I thought, wow, okay, let's cancel this panel. We don't need
it. Yeah. So 15%, but I guess I'm thinking, is that wrong? Is that right? I don't think there's an answer.
What do you think it should be?
Well, I'm from the UK. We have very little production in the UK of anything these days. I would say Africa's are probably lower than 15% of locally produced products. So I'm not saying 15% is right or wrong. What I'm saying is we need to understand what that actually means and what the solution might be. But in terms of your question directly, obviously Shona Quipper, a great example of a business that's grown very, very steadily, I would say, over a long period of time and successfully, and built a business around not just the product, but the provision of the product. So the whole system that's required to get that product to the end user. And that's the kind of resilience that's required, I think, in Africa to be successful as a manufacturer. To not just look at the product itself, but to look at the surrounding infrastructure and really influence around the product. Throwing a product into a very fragile ecosystem is not the solution. And actually, if that's something that's been invested into locally, that's probably a misallocation of resources in the first place. But there's loads of great examples.
Where do we find them?
Well, I think, I mean, prosthetics is a great example on the continent, I would say, where the kind of the combination of physical product, but also digital approaches, digital value chains, 3D scanning, 3D printing has enabled production to happen locally, but not just happen locally, but also to translate to other locations.
Excellent.
Yeah.
Thank you. Wahida, you're from the Census Hub, and I know that I've been there recently, and there's quite a few examples of locally manufactured assistive technologies on the shelves there. So your experience at the Census Hub, what are the things that have been developed locally that you think have been most successful?
Thank you so much, David. As you rightfully said, we do have locally manufactured things done in our office. So we have our 3D printing, and I have one of my colleagues who's responsible for that. But also you've been into our office and you've seen the different products that we have that have not necessarily been locally manufactured, but we've had to actually import from outside. For example, the white canes, blind shell, which is the phone, and we have many others. And there's usually a process that we'd have to go through to get those being bought into the country. But in terms of local manufacture, it would make more sense to go down that direction because, you know, again, we are here in Kenya and trying to do our best, you know, to serve, you know, those that do not have.
And have you seen examples of technology where it's being imported into the country, and that's possibly the best model for that particular technology, rather than trying to locally fabricate? What do you think?
Again, I'll just give the example. So we have had to import the Ambutech white cane, for example, you know, because, you know, with that, you know, you're just giving examples of, yes, it's the best, the quality can take you up to 3 to 5 years or, you know, 15 to 20, for example. But then again, having it locally manufactured, you know, we would want to have the exact same thing as opposed to, you know, maybe getting, you know, the Chinese one, for example. But as I said, again, it would be better to have it locally manufactured here as opposed to us having to bring it in.
And are there local distributors of these imported devices who are more responsible for ensuring the ecosystem is in place? So I think there's this bit between local fabrication and importing, which is about local distribution. And are there companies who distribute all these sorts of devices within Kenya and beyond, in your experience?
Yes. So here in Kenya, I was just in Tanzania last week. And so, you know, they had to, you know, import like the braille kits, braille paper, things like that, because, you know, for them, they don't have accessibility to actually manufacture some of these devices, AT devices locally. But they are distribution hubs, also us being one of them. Yeah.
That's a good chance to say that. Yes. So we already said that we're seeing 3 models, not 2 models beginning to evolve. There is local fabrication and distribution. There's importing where people are buying direct from overseas, but there's also local distribution and support. Ben, let's open that up a little. Have you seen, in that experience, you think this is a product that it is better to be buying it in from overseas or distributed locally rather than trying to recreate it within a specific market? Has that been your experience at all?
I'd say yes and no. I think there are examples both ways. A recent example that I will cite is a project that we supported in Korogocho, which is an informal settlement close by. And the question we were asking, or the local partners were asking, was could we build an economic case around electronic third wheels? And for anyone who doesn't know, electronic third wheel is a device that you can attach to the front of a manual wheelchair, and it enables you to travel 5, 6, 7 kilometers a day on one charge, and it also enables you to navigate terrain that you wouldn't otherwise be able to navigate in a manual wheelchair. And so specifically, the informal settlement kind of context is really important here, in that many people who have a mobility disability, they may have a wheelchair, but they still can't get out. They require help to move around their local environment. So this device is kind of, in theory, something that could help, but it's not produced locally.
Right.
You can ship from China, or you can ship from India, or you can ship from Colombia. So in this case, importing the product makes sense, but it's not the final solution. That's really just a way of testing the use case. So what we've tried to do with partners locally is build the economic case around access to that product. And through doing that on a very small scale, we can show on a daily basis that users who were actually not able to leave the house are now able to not only leave the house, they're able to buy and sell goods. They're able to travel to the market 3 kilometers away, buy some goods, travel back, sell them. And the economic case is commercial because they're hiring the device. They're hiring the device from a hub for 200 Kenya shillings, but they're making 400 Kenya shillings a day working. And it's not only the economic case, but they're being accepted by the rest of the trading community in their local area. So they're being seen now within the community. And that as kind of in terms of social impact is probably, we would all agree, more important. But when we talk about policy, the economic case is the one that really flicks the switch, you know, because everybody knows it's the right thing to do, and we can tell those stories. But if you can show the economic lever to the policymakers, that then enables much more a much healthier conversation around.
I couldn't agree more. I think we still have a fairly weak understanding on the return on investment of providing assistive technologies.
Yeah,
and where does that return come from?
Yeah, and it's not just who pays. The go-to kind of thought process there is that you're selling a product to somebody; they have to pay. But there are lots of ownership models that we can explore that enable that transition to access, like leasing the product. You know, it can be a B2B model, so you could sell the product to to local corporates who then lease the device to their workforce. They then are able to employ a much more diverse workforce. That workforce is then becoming economically empowered. So I think the model around ownership is not just a simple kind of buy and sell transaction.
Let's just hand over to Shona. Shona, in your experience, are there still some products where you still believe that the right model is to buy it in, whether it's to do with the quality, ease of access, experience of the companies? What's your feeling? Are there examples of that?
I think it's a continuum. I think as more and more traction is gained around local innovation, transitioning into accessible products within a healthy, supportive ecosystem, less and less need will fall on importing product. The cost of the product is important, but it is not the driver. The outcome of the use of the product is the measure of success. And the more we shift our thinking away from counting the numbers of products that we can get to people, and rather the impact those products are having on individuals' lives and their ability to function and be included in a way that is not only building internal locus of control or internal ability to be yourself, but the ability to be economically active, that market is slowly shaping itself away from the need for imports. I think the need for people who use AT as a tool to have choices around the quality of the product they use and the look and the feel of that product and how it affects them personally needs to become the narrative of the future. And we are really working with governments to focus now on value-based outcomes in their procurement policies and not numbers.
Great, thank you. So I want to turn to the audience again at this point. And can you just give us some examples of devices, assistive technologies that are manufactured within your countries and which have had a successful uptake by people with disabilities? Has anybody got any examples they'd like to share? Oh, we're going to need a microphone for you. Oh, it's running round at speed. Thank you.
We have wheelchairs made by bamboo trees. Then we also have standing aids made on cartons.
Made from?
Cartons.
Okay.
Yeah.
Excellent, thank you. Any other examples? Another example? Yeah, over here.
My name is Diana from Kenya, Miss Inclusive Kenya. Although so many components from the prosthetic are being imported, but prosthetics are actually made in Kenya. And there are two types of prosthetics. The one I'm wearing, which is it is not actually a monolimb. And then there's also a monolimb from Swissability, which I'm actually representing today, which is made from plastic, which is an advanced one. Yeah.
Okay. Any more examples? What about the other side? Are there products that you know are imported that you think they have been well used within my country? Oh, so if you just take the microphone from there. Go on, Jenny.
Yes, and I'm not advertising this company, but an Eschenbach, the German-made magnifiers, different size. You can drop that thing, which blind and visually impaired people can do. It falls into pieces all over, and you've got to scramble around to find them, and you put them back together, and you turn the light on, and it works for years, as long as you need it. And I just think that it's a very expensive product, but the quality of it to come in is just to know, that is going to be, well, that was before I discovered a magnifier in the phone. But, just knowing that you've got a really good product that will do the job, and then it can be donated afterwards with low vision to the local government hospitals to then be given away to the people who do need them.
Anybody else want to throw one in at this point? I will give one example that I'm aware of in Africa, which is NVDA, Non-Visual Desktop Assistant. Now, the interesting thing when we talk about this one is that it's free and open source. It's downloadable from a website. But there is one really important element that has to happen, which is localization of the product. So this is an additional model that sometimes we need to be thinking about. It's not about manufacturing it locally, but it's having the resource and the finance to put into localizing a product that is successful elsewhere for use within Africa and African communities. And I think sometimes we forget that actually that is okay, that is acceptable. I used to work in the Middle East, and we spent several million reals on localization of products. At the end of that, we had 35 products translated, localized, and available in Arabic, which previously didn't exist. Some of those were available for free. In the others that were commercial, the companies around the world retained the right to sell into those markets. but the investment of creating a product for that market had happened already. So there are other models, I think as Ben has touched upon, that we can draw upon. Bernard AI. Summarize all of this into a short, sharp set of sentences for me. Prompt engineering there for him.
Oh my God, okay. Yeah, so I guess a very rich conversation, and I'll just speak to some of the things that resonated with me. And it's how the different speakers are thinking about the context for manufacturing. And I think this is really important because manufacturing as an idea is not just a product-driven idea. I mean, there is a larger manufacturing economic agenda for any country, any ecosystem. And I think what we are seeing with assistive technology is the early models of what that could look like and what the incentives are for it to make sense. And I think the other interesting idea that I'm hearing is, especially in the context of what the user wants, is such that there should be no barriers for a user to acquire what they want, regardless of where it's manufactured, if they want it. And I'm talking about the user, again, back going to the idea of the agency, but not generally for a country, because a country has to make considerations that make sense both in the short term and in the long run. And I think in the long run, what we are hoping is going to happen all over Africa is that as countries become stronger economically, because the idea of manufacturing is not just a challenge for assistive tech. I mean, in Kenya, we've had this concept of motorbikes that we call boda boda. And there was a time the then president waived the duty on motorbikes. And then anyone could import a bike and use it for business, to shuttle people. But over the years, because it's been happening for more than 10 years, the ideas around, okay, there is an economic model here. So we are seeing a lot of other players making those bikes locally. And more so, even leapfrogging the idea of a bike and going directly to an electric bike. So I feel like these are very interesting concepts for people in the AT space to look at, and to look at it both in the short term and in the long term.
And do you think that sometimes we're a little bit too blinkered in our thinking and we're not looking at other types of import local fabrication to learn from that and not just focus on the assistive technology?
Absolutely, and I think there are many parallels and adjacency of other sectors, like the mobility sector is one of them, which is very vibrant here in Kenya, electric mobility. And for me, my secret and also secret desire was that the electric mobility advancements that are happening can help leapfrog some ideas around accessible public transport because of some of the design elements of electric buses in other sectors. So, but unfortunately, we are seeing situations where it's becoming a missed opportunity. So for example, where there would be space for someone in a wheelchair to get on a bus. I've seen a bus where, they saw the space and they just added extra batteries for that, utilize that space to put extra batteries for the bus. And so it beats the whole opportunity.
Thank you. Okay, we're going to close that session down and we're going to turn to our fourth panel, whichever one it is. I did tell you I was not good on numbers today. On this panel, we have Steve, Jean, and Wilfred. And I think we've begun to touch upon one of the major issues which is going to come up, which is how is this technology paid for? How is it funded?
Thank you so much, Dev, and everyone who has discussed this. I think for me, I cannot say that only one model can sustain itself. There is an interdependency of systems. For example, if we take the case from Rwanda, there is a public health insurance which is used by the majority of more than 75% of the population, called community-based health insurance. And the government has been willing to strengthen this scheme to ensure that more, when I say more, like previously there was low-tech assistive technology, but now we are moving to more like high-tech assistive technology so that it can be covered and so many people can benefit from it. There is also the social protection scheme, which is in charge of taking care of persons with disabilities who are not able to co-pay through community-based health insurance, which pays 10%. Like the scheme pays 90%, and then the user pays 10%. So unfortunately, there are users who cannot even afford that 10%. So there is a disability grant which supports that. And then there is partners who can intervene and say, if the disability grant cannot afford to pay this 10% on behalf of the user, then let's come in. So that interconnectedness and interdependence really increases access as the current models. Thanks.
Thank you. And if we just want to build upon that just a little bit, distribution as well as funding is critical. So we have two types of funding. We have investment in development, and then we need sustainable funding to pay for each and every device, sale, and so on. And sometimes I think we get hung up a lot on the investment, but we do need to make sure there's sustainable funding to pay for the equipment once it's developed. But that also requires distribution. And I just wondered if you'd seen effective models of distribution of assistive technologies, particularly in more hard-to-reach areas.
I might try and take this one. For assistive technologies in particular, there are what we call asset financing models or letters of credit, but I must say it hasn't been at scale on the continent, meaning very often when you have a physical device, wheelchairs and others, what you as a company would do is you would look for money, import 2-3 containers, store, and then when the customer comes, then you distribute, right? Most of the banks don't have any idea of that space, and usually it's investors or high net worth individuals, like the aunts, the grand aunts, etc., that say, okay, I'm happy to help you to buy this container. Once you sell this, then pay me back. But truly, that phase of financing assets is also very, very low on the continent. But I believe there's a massive space as well. Then the other aspect, and I think that was mentioned also, is substitution that to local manufacturing. That would really break that particular pattern out. But it's true that working capital asset financing is a big need. There are not that many people who are doing it, especially the banks.
Wilfred.
I just wanted to add to it that I think a group we did not talk so much about is support organizations. You know, the distributor, I think we know all the stories of containers with wheelchairs rotting somewhere because nobody gets them to the customers, and also the important thing is also maintenance. I think we need to think the whole ecosystem to get it, of course, to the customer or the one who pays for it, but also what happens, you know, if a wheel breaks, if, you know, whom can I go to, because just distribution doesn't reach far enough.
I think that takes us back to a point that was made right at the beginning of our discussions around the ecosystem. Yeah.
Yeah, thanks so much. I think I wanted to add on, like we distribute, but then the product reaching the user requires appropriate assessment, fitting, follow-up, and repair. Most of the times you will find that the products have been abandoned just because maybe the fitting was not appropriate, because the providers lack skills to start from identifying what is really needed and which appropriate product will serve the user. Will it bring positive impact in their lives? Because what we need is health outcomes are improved. So there is one, distribution, but again, there is a need to ensure that those providers have required skills to provide and do repair and maintenance.
Excellent, thank you. Yep, one more, and then we'll go to our audience.
Thank you, Robert. So I had a last point on the financing side. So we've been in the AT space for the last 4 or 5 years, and what we realize is that there is a great opportunity now to build a network of angel investors. So we're launching that, where we're saying, look, if you're interested in the space, or you have an uncle or an auntie, a nephew who is in the space, even $1,000 can go a long way. So we're building a network of angel investors to essentially help put more funding in the space and hopefully attract more funding through various aspects. And so just to illustrate that, we need to start thinking creatively about the space and where the funding mechanisms can go and who can do that. And one last point on the working capital, I think there might be an opportunity actually, because of lack of awareness, maybe train microfinance institutions on the IAT space, where they can start, the underwriters of loans can start saying, actually, I understand this space now, I can do something in that space, just like as they did in agriculture and other sectors. It's just lack of awareness. And related to that, same thing, on the Angel Network, we also want to be able to train as many people to understand the space, because a lot of it is ignorance, and then get them to invest. So banks, microfinance institutions, any basically capital provider, train them, make them aware so that we can get to the next level. Thank you.
Excellent, thank you. I think one of the things I take away from that discussion and from some of the other things is that it's probably a mistake to talk about a single AT ecosystem. There is a very distinct difference that emerges between what I would call traditional AT products, wheelchairs, prosthetics, eyeglasses, hearing aids, etc., and digital devices. And interventions by government may need to be quite different compared to considering which one. So for instance, one way you can intervene for digital devices is for the government to take a view, right, we will offer a discount on tariffs. If you have a disability card, your tariff will only cost you 50%. Or we will discount certain models of phone and we'll subsidize the cost of them. That actually then offers access to things like training for some of the more traditional products as well. But it's specific to the digital AT ecosystem, not to how we manufacture, distribute wheelchairs and so on. So there is this crossover, but they are two quite separate models in many respects. So just to finish off this discussion, can anybody identify a product, types of products that are well funded or effectively funded from within their country, where it is easy for people to get access? And any types of products where you, in your experience, what we've got, there's a hand, sorry, yeah, looking the wrong way.
I think one of the, I would say it's in between AT and medical device, I believe, is hearing aids.
Yeah.
Again, obviously it's not enough on the continent, but I've seen across more than 20 countries I've interacted in, where hearing aids are very, very, very much available at price points that are becoming much more affordable, right? And sometimes, to try and lure in investors, I talk about HearX, which is a great South African company. Obviously, everybody knows it. We talk about it all the time, yes. But I think there are other ones that are localized, that are producing at a fraction of the cost, that are giving access to people, even in remote areas. Obviously, glasses, etc. But the hearing aid one is, for me, quite an impressive one because of the trajectory of the company. Thank you.
So, Mr. AI, how would you summarize this part of our discussion?
Well, your credits are running low, but
always.
Yeah. So I think when it comes to this topic of financing, it's always very interesting when you hear how different people think AT should be financed and the models that exist. But I think how I would look at this is we have a number of models where there is actually a paying customer for the assistive technology. And I would say, while many people look at government and say, well, we sell to government and they think that is unusual, I would actually say government is the only morally obliged customer to pay.
Fair point.
And that's an important point because that makes them a customer that you can force to pay based on the existing moral contract. And when you look at Western countries, they've perfectly been able to do that. And I'm not saying it's the only model, but this question of there is no customer, there is no market is not true. There is an existing customer. How do you unlock that customer to buy more and to buy right? The other thing that stood out for me was what Steve was talking about being more creative in thinking of who are the funders that could be financing AT, but for some reason, either because they don't know, they're not doing it. And how do we unlock that? Because if you look at many African countries, we have very strong small institutions called savings and credits societies, and also like smaller ones, and they hold a lot of capital, but many times assistive technology wouldn't be even a thing, yet many members, especially people who are employed or groups of women, are somewhat always affiliated with one group. So I think that's also quite impressive, and I think also going lower to the level of, when you look at the spectrum of investing in a business, in innovation-driven businesses, this idea of angel investing has proven itself in many other sectors beyond AT, and it's easier to convince an individual than an institution to invest in an idea. And I feel like it goes back to the same question of how much do people know about AT, and that AT could be an investable business. So
Okay.
those were the highlights for me. Thank you.
Right, I need you to take a deep breath and think about how you're going to summarize all of the discussion. I'm just going to get my credit card out to up the credits. I might need to go to the enterprise model for this. But before we do that, we'll come back to the humans in the loop. As we know, Bernard is not a human. What do you take away from all the discussion, all the experience and the insight that we've heard today, not just from our great panelists, but from yourselves and your own experience as well? Just give me one thing you would take away from that we should remember and not forget as we go forward from here. Or have we exhausted you and are keeping you from your lunch? Yep, one here next to Anya.
You allow me to. My name is Julius from Uganda. you allow me to diversify a little bit. My concern is about when all this is said and done, how do we bring in the tax authorities to try to create some favorable taxation so that we can make these items cheap? I'm looking at the tax environment and how conducive it can be for the assistive.
So are you talking about things like value-added tax that's paid by consumers or taxation on companies?
In general.
In general,
really,
okay.
In general, yeah.
So I think there were two different things there. And we have seen countries introduce lower rates of corporation tax paid by business for socially good products and services.
Good, so I'm looking at how tax authorities can really make this.
Great contribution, thank you. Yeah. Which one? Oh, Fernando, yeah. Thank you, Satish.
So what I take with me from today's conversation is that there is no one size fits all. Just like with AT itself, it's not a generic product, it's a personalized product. The solutions that societies, the strategies that societies need to implement need to take into account that each sector has its own characteristics, and that relates to not just payment, but distribution, awareness raising, training. Every aspect of it has to be custom designed for that sector. Thank you.
Perfect, thank you. Satish, and then we will come over here.
And just to complement to what Fernando said, I mean, I think listening to the different interventions, one key takeaway for me is I think we still need a sort of a diagonal approach in this part of the world, as well as in many countries. An approach where we continue building on the vertical interventions, those beautiful innovations, those wonderful new technologies which are coming in, but also an horizontal approach where we continue to integrate assistive technology in health, education, social welfare, using an ecosystem approach, remembering that product is one piece of the puzzle, but we still need to have the workforce, we still need to have the service delivery mechanism, we still need somebody to pay for those products, and we need to have the evidence and information around it. Thank you.
We've got another one here. So I forgot your name. I saw it earlier and I've completely forgotten it now. Behind, yep.
Okay, so my take home is that assistive technology in Africa should not be considered as a charity work, but it should be considered as a human right for everyone. Yeah, thank you.
Thank you. Yep.
Good afternoon. My name is Phoebe. If we can onboard the Bureau standards, it can be a great idea. Yes, many companies can come willing to bring their assistive devices, but what about if they don't meet the required standard? Assume some people are just making the wheelchairs and they don't get the specifications to be used on these wheelchairs, or the brailles, or the white cane. So let us involve the Bureau standards so that when we make these things, they're up to the standard. Thank you.
Thank you. Bernard. Yeah, I think you might need to. Off you go.
Yeah, first of all is to thank our round and also round table participants for spending 2 hours seated and giving your knowledge, insights, ideas. We really appreciate you. Let's give them a round of applause. And also to thank you, our audience, because there are many sessions that don't get a great turnout like this. So please appreciate that you came and participated, and I hope so meaningfully as well. Round of applause for you. And of course, our chief moderator, who, in as much as said...
Who still loves the sound of his own voice more than anything else.
in as much as say he's a horrible human being, I think we've actually found is the exact opposite. He gave us all a chance to contribute. I think for me, the way I would summarize this conversation is that today is a very special day. One, we are in a way aware and celebrating what our ecosystem, all the efforts that we put together. I think this is the day that you need to reflect and give yourself a pat on the shoulder, if not anything else, while the AT Day. But I also think the other win is so much knowledge, expertise has been shared in this session, also on a day when there's a new report on assistive technology in Africa. And this is going to be an addition to a lot of evidence that our space is generating. It's not the first report, it's not going to be the last one, but that's a very good signal in terms of how well resourced we are to make a difference and to have the evidence to go with. So my takeaway is, now with the knowledge that you have, and remembering that we're trying to build an ecosystem, go find your place in this ecosystem and do your part. And then if you remember, for those of you who attended my keynote in the morning, I talked about this analogy of a forest and something called mycelium, which is underground, is under the forest, and it connects everything else. And we are the mycelium of the disability inclusion AT ecosystem. And we all have a role to play to make this happen. And so I would like in other sessions, maybe from next year, for us to come and discuss ideas or how-tos, let me call them how-tos, because we understand the problem way too well. So now what we need to do, if you go out and you're able to do something amazing that could address any of the issues raised, please share it with the network, because that's going to help us push the sector forward. So thank you very much. Yeah, over to you.
Thank you, and thank you so much. But he had to listen to it all and try and stay awake throughout, as you all did. And congratulations for making it through to this stage. I do want to thank everybody. I do want to say again, please, this has been a good conversation, discussion. The actions we take from today are more important than the discussion. So do please join the Inclusive Africa AT network. Make your contributions, because we will only move this forward collectively and together. And it may be slow, steady, but we can do it. I will just simply plug, one person said about awareness of AT. Make one plug. You've got the chance to tell me to stop in about 10 seconds. IMATEX, IMATEX, is a virtual AT expo that anyone will be able to access in September for free. Give it to people like teachers, therapists, and so on. And so go and spend an hour looking at the ATs that are available in that virtual show. It's one way in which we can start to raise awareness of the greater diversity without the cost of a major exhibition here in Africa and the problems for people to get there. So do please join us. Once again, thank you. Anybody who wants to run for food, go now. Thank you very much, everybody.